Hi, Dr. Scheerer. Thank you for joining us in Big Spoon Little Spoon's Faces of Autism initiative. Faces of Autism aims to elevate the voices of autistic individuals, as well as community volunteers, researchers, and health experts. So Dr. Scheerer is an assistant professor in the psychology department at Wilfrid Laurier University. She completed postdoctoral training in the Autism and Developmental Disabilities Lab at Simon Fraser University, as well as the Brain Mind Institute at Western University. So let's get started with our first question. So for Dr. Scheerer, what is most innovative about your recent research projects on autism diagnosis?
Well, to start off, thank you for having me. I think so. The project that we've been working on recently, we're focusing on the experiences of both autistic adults as well as parents and caregivers of autistic children or adults as they try to pursue an autism diagnosis in Canada. I think one of the most innovative and novel aspects of this research is just the fact that we're focusing on adults as well. I think a lot of the research about pursuing diagnoses and looking at diagnoses focuses exclusively on children, and that sort of misses a whole group of individuals who might have very different experiences because of their age. I think another novel aspect of the work is the fact that we're looking all across Canada. So we're trying to compare across all the different provinces to try to understand whether policy differences across these different areas might lead to very different outcomes when it comes to trying to get a diagnosis.
Yeah, thank you for sharing that with us. Our next question for you is, what has been the most challenging aspect of researching autism?
I think for us, it's definitely related to recruiting participants. I think autistic people and their families are often really busy and they're already coping with so much in their lives that it can be difficult to get people to make time for research, especially when we don't have a ton of funding to always pay participants to come in and do our research. That can sort of limit who we can reach. I also think there's sometimes a little bit of a trust issue. I think autistic people and their families often experience lots of hurdles when it comes to the healthcare system and when it comes to navigating services and other sorts of resources. And sometimes I think that sort of extends to the research environment, and we sort of get lumped in as part of the same group. And so I think some of that mistrust can sometimes make people reluctant to engage with researchers.
Thank you for sharing that with us. Another question we have for you is, are there any particular stories or experiences that have deeply impacted or inspired your research today?
I think for me, I have two that really come to mind. The first is sort of the reason I first decided that I wanted to pursue autism research. And that was when I worked as a counselor in a camp when I was an undergrad, so it was many years ago. And as part of this experience, I had a lot of one-on-one experiences with autistic children. And I think seeing how different each child was, and to be honest, one of the biggest things that struck me is the relationship between the child and their family, and seeing the families that came to pick them up and their responses to one another. I also had some time to get to know some of the parents because we would speak about the child's needs, and just sort of understanding the family dynamic and knowing that autism just doesn't affect the individual, but also those around them. It really made me want to learn more about it and learn ways that I can help support and improve the lives of not only the autistic person, but their families and those trying to support them. So I think that was one of the reasons I wanted to pursue autism research in the first place. Since I've started doing autism research, I've had the opportunity to work alongside a lot of autistic researchers. And there was one in particular that I worked with in BC who just really trusted me to share a lot of lived experiences. And I think learning about their experiences, particularly with sensory information and how they navigate their environments so differently because of their sensory experiences, a lot of those conversations have actually guided the research questions I'm working on now. So again, I just really value speaking and engaging with autistic people because I think you can learn a lot about their experiences and how you can help support them.
Great. Yeah, thank you again for sharing. And our final question that we have for you is, based on your experience, what advice would you give to undergraduate students?
I think in terms of engaging with the autistic population or engaging in research in general, I think the best thing, and the thing I always tell a lot of my students, is meaningful research and volunteer experiences can sometimes be difficult to find, especially at first. Lots of labs and organizations are very busy and they have a lot going on. So although you might be really interested, sometimes if you reach out, you won't initially receive a positive response, or you'll be given jobs that don't seem meaningful at the time. So maybe you'll be asked to sit at a registration table or clean up or sit and code data, things that might feel like you're not making a difference when in fact they actually make a very big difference. And the more experience you get volunteering and working in these roles, the more likely you are to kind of work up to bigger roles. I also think that just making clear your interest is important. So when you reach out to try to volunteer or to try to do research in a lab, make sure you make it known why you want to do that, because often hearing people's motivation for volunteering can really affect who's chosen for those positions. And I think just generally speaking, that knowing that what you do is appreciated and it's important regardless of what the role is, I think that's an important thing to keep in mind. And I think it's just really helpful to get involved in the community because there's so much you can learn about autism by volunteering or doing research. It's sort of cliche, but there's the old statement that when you meet one autistic person, you've met one autistic person. And it's so true. Just like non-autistic people, people with autism can be very different and they have unique interests, personality traits, and needs. So it's important to not make assumptions about them and instead use these experiences to learn more about autism.
Thank you. And thank you, Dr. Scheerer, for sharing with us about your research, with your insights, and also your expertise. On behalf of BSLS, Big Spoon Little Spoon, we are so thankful for the opportunity to interview you today. Thank you, and we'll see you next time.
Amazing. Thank you for having me.